Welcome to Physicians Who Lead, the podcast where we sit down with physician leaders who are shaping the future of healthcare. Each episode, we dive into the real challenges facing our system today and hear directly from the physicians leading the way with innovation, resilience, and vision. If you want to understand how healthcare is changing and meet the leaders driving that change, you're in the right place.
Hello, welcome to the Physicians Who Lead podcast. My name is Kevin Kirkpatrick. I am the host. Today, my guest is Dr. Victor Vargas. Dr. Vargas is currently the Chief Medical Officer for Health First, but that's not his whole story. So, Dr. Vargas, I'm going to ask you to share with us how you got here, and then we'll get down to business.
Well, thanks for having me, Kevin. I'll try to make it brief. Jumped in healthcare right after high school. Joined the Navy. I became a medic. Had no intentions of medical school at all, but I just wanted to get out of my house and get into the military and have a career that I can do for forever. And it was my experience as a corpsman that really sparked my interest into pursuing my career in medicine. And there was a moment in time where I became a reservist, and I was working for a primary care physician, solo practitioner, and I was going to college, taking classes. And it was him and the patients that really kind of encouraged me to really reach for the stars and pursue a career as a physician. So I ended up applying to medical school, went to school in the Caribbean, in St. Martin, American University of the Caribbean. And then after that, I did my family medicine residency program in North Carolina, in Cabarrus Family Medicine. And then during that time frame that I was in residency, I commissioned in the Air Force as a physician because I wanted to give back my time to the military, because I felt like if it wasn't for my experience in the military as a corpsman, I would have never become a physician at all. So I spent some time in Montgomery, Alabama, as active duty. And after my first deployment, my wife said, we have to make a compromise here. I want to get back to Florida, and I don't want you doing this full time. I gladly obliged to that, and we ended up in Brevard County, Florida, the Space Coast. I was a reservist at Patrick Air Force Base, joined Health First at the same time as a primary care physician. And during my time in as a reservist, there's a very unique unit here in Patrick Air Force Base, which is a combat search and rescue unit. It's the 308th Rescue Unit. It's one of the most decorated military units. And I later became a flight surgeon supporting that unit, and we did combat rescue, we did civilian rescue, and deployed one more time in 2018. And then I retired in 2019 from my military service. But all that time, when I was here in Brevard in 2012, I was working with Health First, who supported me through my military career, but also advancing my career on the civilian side. And like I mentioned, I was a hospitalist, did primary care first and a hospitalist. Shortly after that, became the team lead because I love solving problems. So I would get myself involved in a lot of different process improvements and quality improvements. And then I was selected to be the system medical director for the hospital service, which is 4 hospitals. We were at the time 4 siloed hospitalist teams that had no kind of interaction with each other. So I was tasked to, take 4 silos, make it one team, one group, one unit, and later took that team from 40% locums to 100% hired, and haven't had a locums or any temporary staffing for almost 8 years now.
Awesome.
So it's really, really changed the culture there. And then after that, when I came back from my deployment in 2019, I became a VPMA. Vice President of Medical Affairs for 2 of our community hospitals. Did that for several years, and then I moved over to be a VPMA of our Level 2 Trauma Center. And then I'm coming up to almost a year. I'm 10 months into my role as the Chief Medical Officer for the hospital division. So I oversee all 4 hospitals, 950 beds. Like I said, we have a Level 2 Trauma Center and 3 community hospitals. And then I have facility CMOs at each facility. And I oversee the physician advisors and medical staff services as well.
I could probably spend an entire podcast just asking questions about your military service. But what I'm going to ask is, having served both as a military physician and now as a hospital CMO, How have those experienced your leadership philosophy?
I think the military and my civilian experience has profoundly changed or established my leadership philosophy. Like in the military, they teach you about, role clarity. They teach you about readiness and accountability. That accountability is the biggest piece. And the mission always comes first, and when you care for people, you're caring for them as if they were your family. And I think in healthcare kind of translates the same way. When you're building teams, you want to make sure there's role clarity, that there's discipline, that there's accountability and feedback. And that ties into the mission. So we're mission driven. If you're in healthcare, you're definitely, compassionate. So for me, I think what it's done for me is, I'm a humble leader. It's nice to have the title, but I try to really be a human.
You mentioned feedback and stuff like that. How do you, or why do you believe that feedback is central to leadership development?
I think feedback's the fuel for growth. Without feedback, I think leaders are stagnant. If you look at healthcare, we're always chasing different metrics and KPIs, mortality rates, readmission, length of stay, but we don't really do a whole lot around leadership behaviors. So giving feedback to leaders, using some data about themselves transforms leadership. I think it also instills some discipline. And when doing the right things, you reinforce that. And when there have opportunities for improvement, then you can kind of correct those things early.
One of the things I've found over the last year doing the podcast is there's kind of two things that I hear almost religiously from leaders. Is one is the something you mentioned, role clarity, and the other one is support in an ongoing component, right? And I have some strategies that my company uses to address those. But given that feedback is such an integral part of your leadership, how do you ensure role clarity and how do you support people through the feedback process? Because feedback's not always happy.
Right. So I think, if you just start with the job description is a kind of a stagnant, document. I take it one step further and I say, all right, what are your standard operating procedures? Like what does it look like in your day? Where should you be? Who is your key stakeholders? And I create this form of a roles and responsibility form. And based off of that is how I create the feedback. I will look at the key stakeholders. I look at your peers, who reports to you or who you're reporting to, and create a survey around that. And then using that information, if you're new to my team, I do a 30, 60, 90 day and give constant feedback. So it starts to get comfortable. It becomes the expectation of the norm. And then we do every 90 days as a touch point. And what you discover there is it establishes a level of trust that you typically don't see or feel. And people start to open up slowly over time. So I found it to be a very powerful tool to grow a great team.
So I used to do this thing called the Studer method by Quint Studer, and it was a structured process. And I found that I had to deviate from it almost every time just to keep it from being impersonal and almost like a checklist, right? How do you keep feedback to continually be transparent, authentic, and honest?
I think it's a great question. You definitely have to keep it consistent. You have to stay on top of it. I make it a priority, despite how busy my life is, that I'm going to sit down with these folks and share the feedback. And you got to give feedback with compassion. If there's no compassion behind it, then it becomes like this kind of discipline session. I do use some AI tools. I just use Chat GPT or Copilot to help me summarize all the feedback that I receive, and that kind of dehumanizes it a little bit. But then I have the one-on-one session with my team, and that's where I kind of make it more personal. And what I like to do is share what's going well. I look for opportunities for improvement. I like to sprinkle in, a couple of positive quotes that are coming from their teammates, and then we talk about next steps. And it really, I think people walk away feeling, supported.
Have you noticed any changes in things like morale and engagement? And before we went live, I talked to you a lot about, how engaged organizations recruit better, right? And you mentioned earlier that you've gone from, 40% locums to 0%. So, it seems to me like the engagement's increased. How did you do that? And what have you noticed as a result?
I have a team of 11 physicians that I manage directly. And I would tell you that the morale and engagement has significantly improved. I get feedback constantly from my senior leadership team about the level of engagement, the expertise of the team. They own it. I think by doing this, there's clarity in their role. They feel supported. There's a much stronger relationship between myself and them. And there's a genuine sense of just being kind of seen and heard. Leadership's difficult. You're constantly putting out fires. You're constantly dealing with things and pressures. But with this type of relationship, we pretty much can get through anything at this point. So the feedback that I receive has been very positive.
How do you train other leads? Because you mentioned earlier that you have CMOs that report to you. How do you train them to give appropriate feedback?
So that's kind of like my next phase in this. Like I said, I do about 13 direct reports right now. And now I need to kind of next that. I really need to start expanding that even further. So I started to put together kind of a leadership feedback toolkit. And this is just from experiences from my military days of how we did our evaluation process. And I'm running my team through kind of like a workshop in how to do this work. They've been receiving feedback from me for a year now. Everyone has seen me at least 3 times in the year. So now the next phase is we're going to go ahead and practice this. So I'm going to have them do a feedback session and I'll be there to coach them along until they feel comfortable. And it could be something simple as using a, framework like the situation, behavior, and impact, so that they have a structured process to enable some feedback.
One of the things that I've seen over the years, because I've recruited people from the military and stuff like that, there's a real ingrained leadership component, given the sheer force of what it is you're dealing with. How do you take that and implement it within a civilian environment where everybody's not trained through boot camp and things that are consistent, right? Everybody's not trained the same, so.
Yeah, I think three things come to mind: clarity and mission, having an after action review or kind of a debrief, and as a leader, having a servant leadership mindset. So if I have a clarity and mission, everyone knows their role, they know their job, they know their lane. When there's opportunities to provide feedback in real time, we debrief. If not, they're going to get it when we have our formal feedback session. And, I see myself as very humble. I don't really try to lead with my title. I lead as a person, as a human. I serve my team. So I think, I get the same in return.
So one of the things I often am curious about with CMOs is, their relationship with the corporation, right? And I had a doctor CMO once coin the phrase a fake input meeting, right? Where his role was to basically herd the physicians, right? And the decision had already been made. How do you manage, when you have somebody you report to and then, autonomous physicians that report to you as well, right?
So you kind of stuck in the middle.
Yeah. Yeah.
Yeah, yeah. So I manage up. So I report to the president of the hospital division, and I try to think proactively, think ahead of him. So I try to feed him information to make him successful. Foundationally, we have a mission, we have strategic goals, and then we have to operationalize those. And then in my role, I have to translate those strategic missions to my physician leadership team and then down into even the medical staff. You have to explain the why. You really have to explain the why behind why we're doing certain things. But I also think that as we are moving along in trying to achieve certain strategic goals, you're still living day-to-day battles. People are still frustrated with the system. There's behavioral concerns that have to be addressed. And we have to be consistent. We, meaning the physician leaders, have to be consistent in how we conduct ththose sessions. But we also try to connect the accountability discussions around our values as an organization.
I find so much that I leads people through the recruitment is usually mission driven, right? Like, and it's interesting because the organizations that have the clearest mission often seem to be the ones that are the easiest to recruit to, because people will be engaged with that mission both professionally and personally, right? What's the hardest piece of feedback you've ever had to receive?
So I would say the hardest feedback I've received is not getting any feedback at all.
Mm,
And I'll tell you, early in my career, I'm working hard. I'm early in as a leader. Feel like I'm hitting my goals. I'm supporting my leadership team. I'm supporting the mission. And there was an opportunity for promotion that came up, and I felt like I was ready. But then there was this hesitation. There was kind of like this pause, and I wasn't sure if it was because I wasn't capable or someone wasn't preparing me for that next level. But to me, the pause kind of said everything because I really did not know where I kind of stood as a leader. So I realized that this just the silence alone was also, feedback. And to me, that was pretty painful. It was definitely a gut punch. And it was like from that moment on that I committed to whoever my peers are, whoever's reporting to me, that I would never let them experience something like that. And that's where I made that commitment to normalizing feedback and putting feedback as part of my own structure.
and it's, I'll tell you, that resonates with me because I worked with an organization before going out on my own. And, I was in line for a promotion to the point where they had scheduled, the interview. And then when I went to the interview, nobody showed up
Oh,
because they,
wow.
they had made a corporate decision not to replace the role, but nobody thought to tell me. Right. And,
Right.
I think within 4 or 5 weeks I left, because I was like, if you can't lead, and provide feedback, and if there's concerns, and I'm okay with that. Like at the end of the day,
Right.
I believe in it, and I think the luxury for me in my business is feedback is innate in the business model, right? Like if someone doesn't like
Exactly.
your candidate, you get feedback. If someone loves your candidate, you get feedback. If you're hitting the mark, you get feedback. So one of the things that, so I'm a bit of an older guy here, just hit 51. And one of the things that I've started thinking about is like legacy and, what stamp am I going to leave on the people in my lives and stuff like that. So as a physician leader, what do you think you want your legacy to be?
That's a great question, and I'm a couple of years ahead of you, and been reflecting back of my professional legacy versus my personal. I think professionally, I want to leave behind a leadership culture that's calm, accountable, kind. I like to keep things very, very simple. Um, I like to create an environment where feedback isn't feared; it's just the expectation. Where leaders feel safe enough to be honest, humble, and humble to grow. And if I can hand over a system that's developed and this is what's ingrained, I would feel very comfortable to say, mission accomplished.
And it's interesting because I have a friend of mine who works in organizational resilience and stuff like that. And one of the key things that she constantly advocates for is to feel safe. And it's such
Mhm.
a hard thing in healthcare because the fear of mistakes and litigation and stuff like that's so hard, right? So I can appreciate that, and how feedback plays into it as well, right? So
Without a doubt.
it's a great thing. Now, the question I try to remember to ask all of my guests is there somebody in your career that's been a mentor to you, that's left a stamp on you that you'd like to talk about?
I would say the person that really stood out to me the most was the physician that I worked for when I was in college. His name is Neil Gold. He's a solo practitioner in Delray Beach, Florida. I was in my early 20s and basically grew up as a young man there. He taught me everything from, personal finance to professionalism. And just watching him interact with patients and his compassion and his dedication to his patients is what really drove me to pursue a career as a physician. And at the time, I didn't have the confidence, nor did I even imagine that I would do this. But he just kept encouraging me, both informally, we would have conversations, but also through his actions. And I've never forgotten that. Worked with him for about 11 years. And when I left for medical school, I came right back after I graduated, to show him that I made it and honored him for that. And when I deployed, I would always come back, and just to check in with him. And most recently, I was down in Fort Lauderdale, not too far from where he is. And, we connected again. And I always remind him and appreciate him for what he's done for me.
That's awesome. That's awesome. Well, Dr. Vargas, it has been a absolute pleasure. I thank you for your time. I thank you for sharing your story and sharing your thoughts on feedback and developing a strong culture. So Thanks for being on the podcast.
Thank you, Kevin. I appreciate your time.
Take care.
All righty. Bye now.